6 in nearly 100 people is roughly the number of those who at some point in their life are affected by post-traumatic stress disorder.
Joining us live is licensed clinical psychologist and UNK psychology professor, Dr. Krista Fritzen. Hello, thanks for being with us. We sure appreciate it.
Hello, and thanks again for letting us be here today.
Today's topic on PTSD, a very heavy but important one for us to talk about. Can you let's just define PTSD and what causes it?
Very basically, post-traumatic stress disorder is an anxiety-based or stressor-based condition, which I sometimes wish was called post-traumatic stress experience to destigmatize it. But basically, a person has to have experienced a trauma, which is a life event that is beyond the typical human experience. They tend to then have avoidant behaviors where they avoid thinking about, talking about, or situations that remind them of that trauma. And then they have symptoms that are related to re-experiencing the trauma in some capacity, such as nightmares, dreams, night sweats, flashbacks, or re-experience it when they're actually alive, when they're actually awake and alert, but they'll almost like relive the traumatic experience, as well as extreme reactions, such as isolated behavior or extreme emotions of anger, or the opposite of becoming detached from emotions.
Yeah, there's a lot to digest here. Within the past 10 to 20 years, this really was brought to light in part by veterans serving in Iraq and Afghanistan wars. It's not limited to military veterans, but certainly they are dealing with this.
Without a doubt. And the first experiences were sometimes called shell shock after World War II. And then, you're right, recently these events of the ongoing wars have brought it more to the surface, but it can be related to people who experience any traumas, like even natural disasters like hurricanes or tornadoes, to medical conditions or losses, and or even situations where sexual abuse, physical abuse, and those kinds of things are quite common to be related to post-traumatic stress disorder.
Is this something that you would know you have it right afterwards? Can it come later?
Excellent question, in that it presents itself formally two different ways. Sometimes it can have a delayed onset, anywhere from days to months or even years after the fact, and sometimes it can be an immediate response.
We don't have a lot of time here, Dr. Fritzen. What do you want to call it again? Post-traumatic stress experience?
I wish we could, just to take away the stigma related to it being a disorder, because if someone experiences a trauma, it's really important to focus on processing, talking about it, and exploring resources to support oneself and others around them.
And just what do we have for options for local resources available for anybody who is experiencing this?
If it's someone related to the military, 988 Press 1 is a great resource. Anyone at all could look at the MyLink app again, region services like Behavioral Region 3 services, the Safe Center, Family Advocacy Network, and even local law enforcement. They will have resources to get people to people who can immediately support others with PTSD.
Dr. Fritzen, we always appreciate your time. Thank you very much. Have a great Monday.
Thank you. You too.